Hey, if you've been struggling with poor sleep, mood swings, irregular periods, just feeling off, then it very well could be, if you're a woman, that your progesterone levels are off. So let's talk a little bit about progesterone and what that looks like. If you don't know me, I'm Michelle. I'm a family nurse practitioner and specialize in helping people with weight loss with GLP-1 medications and also helping people optimize their health by balancing their hormones. So, progesterone, we've all heard of that's one of the main primary hormones we have as women. Men have it too. Um, and for women, it is the hormone that we typically think of. It helps regulate our menstrual cycles. It also supports a pregnancy. And it helps keep the effects of estrogen in check. So, kind of counterbalances the estrogen. But it does a lot more than that. It really helps with insomnia, anxiety, our mood, and even is very important for our brain health. So let's talk a little bit about when it starts to decline. A lot of times we just think about our hormones in menopause, but progesterone is the first hormone that starts typically for women that starts to decline, and that usually often happens in the 30s and 40s. It can be well before we think of naturally as menopause, which is average age is 51, so in that ballpark. So it can happen many, many years before that. And as those levels start to decline, then the balance of your hormones can get off. And we'll talk about that in a minute too. So, some of the symptoms that most common symptoms associated when your progesterone is too low or out of balance is irregular or heavy periods, mood swings, anxiety, irritability, poor sleep or insomnia, not being able to sleep at all, headaches, and worsening PMS symptoms, and then breast tenderness and bloating. Those are the most common. There's lots of other things that can be associated with it, but those are the most common ones. Now, sometimes I have patients come to me and they say, "Well, I had my hormones checked and the doctor said they were normal." You can have normal progesterone and estrogen levels, but there should be a balance between the two. And oftentimes, as that progesterone starts to decline, then the balance is off, and there's too much estrogen for that amount of progesterone, and it causes what's called estrogen dominance. So, it can be helped by just bumping that progesterone up to where it's more in balance. So that's often common where the number's normal and you don't get any help, but it's actually could be helped because of the balance. So the benefits are fixing all those symptoms that we talked about. You have better sleep, less irritability, better mood, more relaxation, helps with those severe PMS symptoms, the headaches, the heavy bleeding, and the shortened cycles, all those things. So typically, we adjust your medications to help your symptoms, but we always want to check labs to see where you're at and see, just check those along the way. So, if you're interested in that, that's something you can do with a kit at home. It gets shipped to you. You can do your test, and then we get the results and can discuss it. If you're a Kentucky patient, then we could prescribe for you. Otherwise, we could do a consult and kind of let you know what your labs are showing, and then you could take that to a provider locally. Also, I will link, we have a quiz that you can take for free that will kind of assess to see if you're showing some symptoms that could be related to your hormones. So I'll link that for you below. If you have any questions about any of this, just let me know.